Come on in.
Good evening. My name is Morgan. I'll be your nurse today. I'm here. I just saw on your chart that you're due for a sterile dressing change. Is that okay?
Yeah.
Okay. Can I have your name and date of birth?
Andrew Wilson. I was born on 5/12/91.
Okay. Let me just check your bracelet with that. Okay. Perfect. And then I see that the LPN medicated you about half an hour ago. On a scale of 0 to 10, can I have your pain level right now?
About a 2.
Okay. Very good. So let me just gather my equipment and we'll begin. Wash my hands. Okay, can I have you place your arm up here? I'm just gonna put on some gloves to move it. There's no drainage present on the old bandage, and there's no drainage present on the wound. The surrounding skin is a little pink, not red, so I would just document that in his chart. That away. And the doctor would like, wash my hands, just a swab of your wound, okay? So I'm just gonna do that as well. Just a Q-tip that goes along your wound, okay? Okay. And I'll make sure this has his name and date of birth on it, and I would put it in a biohazard bag and send it down to the lab. Wash my hands. Now I'm going to set up my sterile field. Okay. My hands again. So you move your arms for a second. Up. Thank you. Now that I have my sterile gloves on, I'm going to take my tweezers and put some gauze in the sterile water. And both of my hands are still clean, so I can use both hands. Okay. Now I'm gonna bring out the gauze because we want it damp, not soaking wet. Okay. I'm just going to take some of this wet gauze and clean your wound, okay?
Mm-hmm.
So outside. Outside, inside, and I'm just going to dry it, okay? Now, can you turn your arm a little bit more flat, sir? Thank you. So this is just wet packing, so the bandage doesn't stick in the doctor ordered wet packing. Okay. And now that the bandage is on, I don't need to worry about sterile field anymore. So I'm going to take this pen, write my initials, the date, and the time is 17:10. And this way, the next person who does the dressing change knows exactly when it was completed. Okay, and there you are, sir.
Thank you.
I'm gonna clean up my area, dump this in the sink. Throw away my tweezers and the sharps, and my gloves. Wash my hands. Is there anything else I can get you?
No, thank you.
Are you comfortable?
Yes.
And you have your call light?
Yes.
Okay. And then I would document my findings, document the time and the date that I did the dressing change, and his pain level when we first started.